removing homelessness from our street, and we recognize many of the reasons for the homelessness can be addictions and mental health. Try to do what you just suggested, where we're maybe sorting a little. I had a conversation with a fellow the other day, yesterday, of course, while I'm standing there running my business.
Substance use and addiction are a significant component of homelessness. It's critical to provide access to treatment programs in any real attempt to address homelessness. Long wait times to enter programs work against those wanting to exit this revolving door. We asked St. Thomas Mayor Joe Preston about this systemic gap. Have a listen. So one of the most difficult parts of the process of recovery is from the moment that someone says, I got a problem, I got to stop now, until they can actually get into a rehab. So it's really difficult when you send someone back to the place where they've been using. Yeah, so has there any thought been given in St. Thomas to a transitional sober living environment? It doesn't have to be massive, but one that you can send them to where they have a bit of support and can be in a better place until they can actually get into a rehab, sort of like a pre-treatment.
Clearly have tried to decide, are we on the cusp of that now? Are we, as we're moving to removing homelessness from our street, and we recognize many of the reasons for the homelessness can be addictions and mental health. I feel pretty comfortable that as we hit this line of removing our by names list of having, we could then try to do what you just suggested, where we're maybe sorting a little. I had a conversation with a fellow the other day, yesterday, of course, while I'm standing there running my business, but who said, one of the issues with Indwell is there still are people who are using, and my son is trying not to use, but it's causing him.
Sure.
And so I agree with you. Perhaps it needs to be, this one is a dry unit and this one is not. And I think we probably would and then this one's I'm trying not to ghettoize though. I mean, this is another piece we can get to where, and then also, how do you measure the failure, not just the success? So I see we're pretty close to where we want to be. And in speaking with Indwell, they're so far down that homelessness crisis that it's just about four walls, a door, and some supports. I think St. Thomas can now be a leader in the pack where we've got all the four walls, we've got the doors, and we've got the support systems in place. But should we target what support is in that in that building versus another?
Sounds great.
Even if it just turns into an affordable housing unit because we actually have, people who have reached their goal of sobriety or now dealing with their mental health in a pretty good way. So
sounds good.
Well, we also recognize, and in my last conversation with Indwell, is some of it is also still, it's a life that I've lived. I've got to change what life I'm living. It's not just an addiction problem or just a mental health problem. It's I'm bored, or I need another goal to reach for. And so the more we can offer all of those things, the better community we are.
It is complex, there's no question.
Well, and I keep saying it. I've been asked a couple of times, well, Joe, you've attracted a lot of high-paying jobs coming to our community pretty soon. What are you doing about making sure people from St. Thomas get them? I said, absolutely nothing. I said, we can go this far, right? And we can talk to the employment services people, and we can talk to the to Fanshawe College and say, what steps would you do today to ready people who are currently not ready for this job, right? And they're going to be in demand. And so we're working on those things. But I tell you, if you want to hide under your mom's bed, you're not getting a job.
No, that's right.
And so we've been saying, I don't know. I'm not a quiet guy. I think I was kind of loud that we attracted some jobs to our community. So what? And I know there's some parents out there doing the same thing. What are you doing to qualify yourself for this job? We've already hired some 450 people to work at PowerCo in this community. What'd you do to get that? And so I think there needs to be some more of that too. And but but I recognize part of the barrier
Sure.
still is some addiction, some mental illness, some just life. I mean, you know, I'm the first employer for a lot of people.
Yeah.
Right, and have been for 45 years now. So I'm now starting to meet the grandmas of the moms of the daughters who have been in my workforce. Right.
Yeah.
But you know, funny enough, as the first employer, Marcy and I take it on as a huge part of what we have to do, a raison d'etre, to teach people to what life skills they need to have in order to be good employees.
Right.
And even some of our housing units, whether it's Indwell or whatever Eastwood's doing or Tiny Hope, there needs to be some life skill training, and life skill training is part of that too. I mean, it just is.
Yeah.
This is what community expects if you're going to be part of your community.
Yeah.